Good morning and welcome to today. Today we have Dr. René van Niekerk as our guest. Welcome, René, and thank you for being here.
Thank you so much. Thank you for the invite.
It's a pleasure. And René is Deputy Director at the Steve Biko Academic Hospital, and also she did a PhD on neonatal care of premature babies. So that's wonderful. Welcome, and please tell us a bit more about yourself.
Good morning. Yes, I grew up in KZN, and I always joke and say I came from the matric dance to the old HF Verwoerd in 1979, and as a student, and I was there my whole career. I spent in Steve Biko now, which now would be 41 years and 7 months in this
Wow.
month. So I've been honored and privileged to go through the ranks. So I really enjoyed my nursing career and all the possibilities of to grow as a person, but also just as my career.
Yes, that's wonderful. That's great. That's really a wonderful career, and I honor you for all the experience you have and all the knowledge you have in being a nurse for so long and at the hospital. So I really think we can learn from you.
Thank you.
Would you mind telling us about how you view presence?
I think if I can explain presence, I think I need to be present for myself because
Mm-hmm.
I can't share what I don't have. So I've got some principles that I follow for myself,
Mm-hmm.
and to be present for myself when I get up in the morning to make sure I know where I am, who I am as a human,
Mm-hmm.
so that when I go to work from the gate to my office, I am present to greet everybody, give a smile. It's important to not walk and talk, look on your phone.
Mm.
Because that is sometimes what we do, and you can't be present when you are busy with something else.
Yes.
At work, I forget that I'm Renee. I become available for staff. So I have an open door policy.
Mm-hmm.
I also um, would like to be there if somebody phones. Be open on the phone. That they can ask you anything. Also, when people come into my office, is to look up from what you are doing and smile, because
Mm.
it allows people to say, I am present for you. How can I help? I think that's one of the very important things for me is to be available. Presence
Mm.
is not just my body, but in actually my mind and my helpfulness and open hand. I think that is to be present, to be supportive, because life is sometimes tough for staff in a
Mm.
hospital, especially during this time, but in a normal time. The hospital is busy, there's lots of complaints, and if people just want to say, you know what, I don't have this in my ward, it's not a problem, let's solve it. How can I help you? It makes
Mm.
people comfortable when you're physically but emotionally also present. Presence for me is also when I was a operational manager or shift leader or area manager, when I used to want to be first on duty, so that when my staff comes in, I always looked at their faces to see,
Okay.
this one today, no, not a difficult patient. You must now allocate her to something else.
Okay.
Um, and just to read their body language, to be actually really present in their presence. And presence also to keep quiet sometimes
Mm.
and just to listen and attentively, listen to what they are saying, but also reading between the lines what they are not saying. So,
Mm.
in short, that is what I would describe as presence.
Wow, that sounds wonderful. And if I can just summarize what I heard you saying is that in the first place, you need to be present for yourself, be
Yes,
be aware of the moment and who you are, and also take care of your own needs. And then when you get on duty, that you sort of become selfless then and focus on the other person's needs, be
yes,
available for them, and also trying to understand how they are feeling in the moment and responding to that.
yes,
And
yes,
I think it's so important what you are saying about being there for staff members, to be present for them and to support them in that way so that they can be encouraged and be there for patients.
for sure. For sure. I love patients. I wish sometimes I could just do patient care.
Yes.
Um, but unfortunately, when you get older, the physical doesn't always want to do what the mind wants. So,
Mm,
but working through staff, caring for staff, and also doing rounds with
mm,
patients and listening and looking around them to make sure that they are cared for. So,
yes. Yes. Definitely. So often we hear nurses say that management does not support them. And what you are saying is the opposite, that it's really your intention to support nursing staff and be there for them. And I want to ask two things about that is what is your motivation? Where does that intention come from, do you think? And also, how do you keep it up? Because I can think that it takes a lot of energy.
yeah, I think for me, I was privileged to have parents that are very present.
Okay.
Um, I think I'm cared for by my family. Um,
Mm-hmm.
for instance, my father would drive from Empangeni, where they stay, the whole night just to be here when I come off my duty to be here with my birthday.
Wow.
So, but it's something one needs to decide as a manager,
Okay. Mm-hmm.
is to decide that when you become, sorry, a manager, it's important for you to understand your role, to be present, also to make sure that it becomes more than just for that moment.
Mm,
Sometimes stores would open up or patients would open up and you need to follow up.
mm,
For me, also, I like to think. I like
mm-hmm,
to have time to think about things, think about life, because obviously, in a day to day, your life touches a lot of other people.
mm,
And people come to you with questions, and if you don't have your own answers for yourself, so I read a lot. I read different subjects. I have a few icons that I like to read from.
mm-hmm,
I also had a personal mentor, um, Mrs. Durant, who's now passed on. I
mm-hmm,
think a lot of people who did admin or nursing management at University of Victoria went through her
mm-hmm,
classes. Um, she challenged you to be broad-minded. So I like to attend anything about development or growth or anything. Um, there was a time when I was actually so tired of nursing and studying nursing. I then
Mhm.
did somewhere 360 degrees and did gardening, the
Wow.
a certificate or interior house certificate. So I think one must be able to discuss and talk about lots of subjects, because sometimes you need to give advice or think out of the box. And if you don't think about things like that intentionally,
Mm-hmm.
because obviously because we're human, we try to do what's comfortable for us.
Mm.
And people differ, and you need to listen to those who irritate you, or people who differ from opinion of you, and to think, okay, I hear you, I might not agree with you, but
Mm.
I can hear your side of the story, because one day you will come into contact with somebody who's going to pose that question or
Mm.
ask about that, and you always have to have an opinion,
Okay.
even if it's
Mm.
wrong in somebody
Okay.
else's eyes. So
Mm.
I hope that covered your question.
Yes, thank you so much. That really are nuggets of wisdom, and I believe that we all can learn from what you are saying, and you can become our mentor in this regard. So, thank you so much for that.
Thank you.
I wonder if you have any specific examples of times that you saw presence in practice.
Yes, lots of times. I think uh, for me, I also ICU trained critical care nurse,
Okay.
and one of the most important things is when a patient is admitted, doesn't matter if it's critical care or in the ward or in emergency department, is to be present for the family. It's a very anxious time when family gets sick,
Mm.
and you take a person out of the role, for instance, as a husband or in charge of a family. Now he's become sick. Now he's a patient. He can't eat when he wants. He can't do what he wants. He's
Mm.
actually at the mercy of you. And then to be present and caring for that time. So I've seen nurses say, "Hi, I'm Renee. Welcome at Steve Pico. The lunchtime is this time," and also to say where's the bathroom and orientate.
Mm.
Uh, so that type of caring I've seen.
Mm.
I think which is important, uh, because you being sick is not nice, and it's not
Mm.
normal.
Mm.
So I've witnessed that, and I've also witnessed on managerial side where my direct supervisor would push her calendar aside to listen to a nurse or a registered nurse or a manager to give some of her personal things and just to listen. So
Mm.
I've also heard it, I've also experienced it myself, and also for on the patient side. Um, we always hear about the uncaringness of people.
Mm.
Unfortunately, that one incident or the 10 incidents versus the 1,000 incidents that are
Mm.
positive are always highlighted. Unfortunately, that's one of the challenges we have in nursing. It
Mm.
takes one difficult manager or uncaring nurse or uncaring manager to all the 1,000 things that we correct just blows it out of proportion.
Yes, that's so true. Yeah. Thank you so much for those wonderful examples. I can just confirm of times that I was a patient that introducing the nurse, that the nurse introduces herself and orientates you, it helps tremendously. It puts you at ease. makes you feel calm. So I agree with your examples. Thank
Yeah.
you.
Yeah.
Yes. Renee, you are an active member on a very, very special Facebook page for nurses. Can you please tell us a bit more about that?
Okay. I've been honored to be on the executive committee of the Forum for Professional Nurse Leaders. It's a NGO, and it's managed by nurses who are passionate about nursing. The forum is for professional nurses, obviously,
Mm-hmm.
and the page is managed by administrator of part of the executive committee, and we have active chapters, what we call all over South Africa,
Mm-hmm.
and they in their small chapters or in their big chapters, they organize meetings and in-service training and topic discussions. So it's quite active. And then we also, unfortunately, this year we couldn't have a conference, but then every second year we have a conference pertaining to nursing and nursing management with national and international speakers. So
Mm.
you can go and ask to be invited to the page.
Mm-hmm.
Obviously, we post anything that is supportive and positive on caring of patients, caring for staff, and any other topic that relates to our nursing profession.
Mm.
So
Thank you so
people can
much.
go and get that. Yeah.
Great. Yes, I will also put the link in the description of the video so that people can
Thank
also
you.
visit and see what it's about.
Thank you.
Thank,
Thanks.
thank you so much for your participation. I really enjoyed listening to you and learning from you.
Thank you. Thank you for the invite.
Pleasure.